I think it's good.
Yeah. Okay, so great. My name is Ifeanyi Nsofo with Happy Africa. Just to welcome everybody. So we have Femi, who is joining us from Glasgow, one of the mentors for the hackathon. Ibeme came all the way from Ireland for the hackathon, and he's here with us in Abuja in the office. Wow. And Estelle, I can't see Estelle again, but Estelle is also one of the mentors for the hackathon. And Gunnar, who has been leading on all this, contacting everybody. So Gunnar, just give a wave. Let's see. Let everybody see. Let's see.
Face to the name.
Okay. Excellent. So, so there are different reasons why we thought we should have this hackathon today. Sorry, this webinar. First of all, I just need to say that it's going to last for about 35 minutes, so that we'll go back to whatever we're doing. So let's see background from somebody. If you
can you mute everyone?
Yeah. So can everybody just mute? Can you mute your? Okay. So the noise has gone. Okay. So before we go further, I just want to state that this webinar would last for about 35 minutes, max 40 minutes, and we're going to record it so that everybody just knows that. Let's put that forward before we go ahead. We'll record it because eventually also tweet this video to share experiences of what we discussed today. For those people that obviously are not part of it, so that at least we keep enriching the information out there for people who want to attend the hackathon, and for other members of the team that have been shortlisted that are not attending this webinar tonight. Okay, so just to say that for us as Happy Africa, our HealthMeetsTech agenda, if you like, started 2016 with our Future of Health conference that we usually organize with our sister organization, Nigeria Health Watch. For that particular year, the theme of the conference was HealthMeetsTech. And it was our attempt to say, how do we get practitioners for both health and tech ecosystems come together, exchange ideas, and begin to see how can we start building solutions locally, that take into consideration our local context, those issues that are bothering us health-wise, and how to provide solutions for them. After the 2016 hackathon, one of our partners for the hackathon, after the 2016 Future of Health conference, one of our partners for the conference, Facebook, we partnered with them to now say, okay, how do we go beyond just having a talk shop to now having an event where these two ecosystems will come together and begin to now develop solutions. And that we did at the Co-Creation Hub. IBM's firm, Digital Health Nigeria was one of the partners for that hackathon. And we did that. That went very well. And this year we now said, okay, last year's event was more like general issues in the health sector. But this year we said, okay, let's now narrow down to a particular issue. And that's how we now decided, okay, maybe we should have one that is focused on infectious diseases. And I mean, here we are. And I think that it's a very good thing that someone like me, who is an infectious disease epidemiologist that has really done a lot of work using technology in his base in Glasgow, is part of this. And Ibeme, who has, who is a doctor himself, but also has, has founded tech firms in Nigeria, is in a good place to advise the team members. And of course, Estelle, who is very passionate about antimicrobial resistance and infectious diseases generally, is part of this. Yeah. So at this point, I'll just move, shift to Ibeme. Ibeme, you have the floor now. I can't hear Ibeme.
You might have to.
Remember, your speakers, is your microphone still mute?
I'm back on. Can you hear me now?
Yeah.
Aha, perfect.
Yeah.
So, perfect. Yeah, so just thank you for that. Just thank you for that introduction. And I guess just get into it quickly. Spend a lot of time. So I do a couple of things. One is I have a health tech startup here in Nigeria, and the other is of course Digital Health Nigeria, where we help support other entrepreneurs. And in my time doing things over the last there's some things I find that people often neglect and don't really do that. And so I'll talk about those three things. And I guess if there are any questions you can ask, discuss them. And of course at the hackathon itself, we'll have the opportunity to dig deep. And I'll take this from the digital principles. So there are a few principles for designing digital solutions that have been adopted as standards. And they really encapsulate what we need to do when we are building our solutions around tech. So the thing that I think is as follows. So the first is not understanding the system. So a lot of time we have these ideas about what or what should work, but we don't bring in the people that we're building for. We don't bring in the people and we don't understand them. So the first thing I advise to people that are building is to think deeply about who you're building them for and involve them. And so there's a talk of using customer personas or user personas so that you have a good idea for the kind of people you're building a solution for. You intimately know what they are and who they are, where they live, what they do, their passions, their interests, things like that. It is only when you start to understand the user, that's when you really start to build solutions that can work. And it's interesting because with a lot of the solutions that I've seen that have been proposed, some of them, the users are sort of multi-party users, and that will pose a challenge around what exactly to build. And so if you really understand each individual stakeholder in the solution and sort of plot where each of them intersects, that might be the place where you can find the best kind of solutions. So not just build in isolation, but build with your users and think about what they want and how they interact with it. So the next thing then I'll talk about is looking at the ecosystem. So as part of what I do with Digital Nigeria, I write a monthly newsletter. And doing that, I do a lot of research around who's in the space, who's doing what. And the amount of times that people launch what somebody else has launched 4 years ago and failed without any change is mind-boggling. Like literally copy and paste from what somebody had done and failed 4 years ago. And you find that people are not researching deeply enough. You're not looking at what is in the ecosystem, what has happened before, what is currently in play, how you can link with those. There's no point repeating the effort or trying to reinvent the wheel. We need to look at what other people are doing, how we can plug into that, how we can learn from it, so that we all move together to the future, not make the same mistakes over and over again, which I find people are doing quite a bit. So to recap, first is understanding your user, second is looking at the ecosystem. And then the third thing I'll talk about is sustainability. So building sustainability. It can be a challenge trying to do that in Nigeria. But the only way our solutions will last is if, as we design them, we think about actively who will sustain these solutions, how will they work. And again, we can argue about this, but I find that if you're depending solely on sort of donor funding, that can be a bit not very sure foots to stand on, because donors could easily change their minds about what they would fund, and then you're back at square one again. So if you can build into your systems, into your solutions, a way that your solution is sustainable, that will stand to you for the longer term. So these are just three of a lot of principles around building good solutions, but I find that these are the ones that we often forget and lose out on. And I hope that as we build solutions at the hackathon, that we can incorporate these three at the very least into the kind of things that we do, and it will increase our chances of success. And I think that's my 6 minutes, really, isn't it? Fine.
So, hi, can you hear me now?
Yes, I can hear you. I think that's my 6 minutes there, Abi.
Okay, okay. Thank you so much, Ibrahim, for what you've said and keeping it brief. Estelle, can you hear me?
Yes.
Okay, so the floor is yours now.
Okay. Thank you very much. So, thanks for that introduction. So I have healthcare consultancy, and we look at solutions around improving the quality and safety in the healthcare space. So I'm going to take the conversation in terms of infectious disease. Can you hear me okay?
Yeah, I can hear, but there's this. Yeah, we can hear you.
Yeah, I can hear you.
Okay, so I'm going to take it from the point of view of looking at the impact of antimicrobial resistance in terms of and the impact of infectious diseases on that. Sorry, the background noise. I think someone needs to mute them. So when we're looking at can you hear me?
Okay,
Can you hear me?
Yeah, so now you're speaking, we can hear you, but yeah.
Okay.
Yes.
So in terms of antimicrobial resistance, so we're looking at infectious disease in terms of how organisms like bacteria, fungi, viruses, etc., are not responding to medicines that they were previously sensitive to, right? And in terms of the global picture, the threat with this is that they're saying that this is really the fact that there's so much resistance in the system, in our healthcare space, both obviously Nigeria and global, is that we can't really practice medicine how we used to do it. So the things we take for granted, treating basic infections, preventing infections when patients come into hospitals, etc., we're not able to do that if these drugs are not working. I'm sure everyone's got a story of someone that's, treating malaria repeatedly, treating, having an infection that is not really treated. I can give multiple scenarios of how I've seen that in the clinical setting. So what we're trying to say is that the future, there was a study done by the UK Department of Health Commission study that was showing that basically there's going to be approximately 10 million deaths annually due to antimicrobial resistance if you don't really do anything about it. And if you put that in context, Nigeria is saying, so now currently they're saying about 700,000 deaths, right? And by 2050, it's predicted that it will go up to 10 million. If you compare that to things like cancer that everyone's very familiar and, there's a lot of buzz around, it's about 8.2 million, and things like diabetes about 1.5 million same time base. So with that figure, it's saying that Africa is going to experience about 4.1 million deaths out of that 10 million. And of course, as we know, Nigeria being the biggest country in Africa, we're obviously going to take the biggest burden of that. So when I'm looking at solutions in terms of how we can combat this issue, I'm trying to see how we can use technology to look at some of the surveillance that is done to quantify how bad this problem is. So for example, we're looking at under 5 mortality, which is, the indices in Nigeria is quite bad, and things like malaria, pneumonia, diarrhea disease. These are things that are obviously have a significant impact in terms of treatment options and in terms of antimicrobial resistance. So in the Nigerian setting, there was a systematic review done in 2017, last year, that looked at, because Nigeria had to develop a plan on how to combat this issue, because they basically, in 2015, the WHO said that every country has to have a plan on how to combat this resistance issue that is affecting, the global health space. So to that effect, in 2017, we carried out a systematic review.
So now, because you went on a bit early, so see, remaining time is only 6 minutes. You see that?
Yeah.
So what I did is I made you the host. You're now the host of this. Yeah. So you need to record it well, so we can join you to that one. I'm going to go and start a new one there and share the link to everybody here. Okay. So we can all jump on that one.
Okay.
Makes sense, eh?
All right.
Okay, recording now.
Sorry, has it stopped?
No, go ahead.
Oh, sorry, I thought it was a message about it stopping. So we did a systematic review in 2017. You know, like I said, the Nigerian government said that the Nigerian Center for Disease Control has to be the secretariat to handle and coordinate how Nigeria is going to combat this issue. And we supported the Nigerian Center for Disease Control. So we did a systematic review, and one of the findings was showing that, as we know, I don't think there was any shock there, that about 42% of antibiotic use is over the counter. You know, there's a lot of high usage of children under 5, where their parents are giving them antibiotics for diarrhea, for treatment, for diarrhea and stuffing. So we did a systematic review in 2017. You know, like I said, the Nigerian government said that the Nigerian Center for Disease Control has to be the secretariat to handle and coordinate how Nigeria is going to combat this issue. And we supported the Nigerian Center for Disease Control. So we did a systematic review, and one of the findings was showing that, as we know, I don't think there was any shock there, that about 42% of antibiotic use is over the counter. You know, there's a lot of high usage of children under 5, where their parents are giving them antibiotics for diarrhea, for treatment, for diarrhea and sore throat and simple infections like that they don't even bother going to see the doctor. So what I'm trying to find out is, in terms of the tech solutions, is what we can do to really see how we can build some tech solutions to really increase surveillance of this, to really to be able to quantify how significant the problem is. Because we know everyone goes out and buys malaria drugs, buy antibiotics over the counter without a prescription. But if we can have a system that sort of links the surveillance and try and links the use of this, you know, in the community setting especially, and the surveillance patterns to really speak to the development of national guidelines, development of policies, to see how we can really bridge that gap, really, you know, because as much as we know the problem, I don't think it's really been quantified very well. It's not really been quantified. So really that baseline to help us quantify how significant this problem is. And then see how we can then implement, because so Nigeria currently has a national action plan, which is a 5-year plan that we want to currently look at implementation. And I think doing a lot of work around baseline, using data to really, you know, do strategic planning and look at baseline data will really help to inform decision making on how we go forward, really. So if I'm looking at the tech space, I think that's an area that that I'd like to see some work within that space. And then, you know, when we develop guidelines, I worked as a formulary pharmacist in the UK at some point in my career. And I found that linking that data to how the prescribing pattern is will really help to minimize the impact of this issue. So I think my time is up. Yeah.
Okay, thank you so much. Thank you so much, Estelle. So Femi, over to you now.
Right. You know, thanks a lot for the time. I think I'm just speaking specifically about my experience trying to design a surveillance system for ID in Nigeria. And I think the main thing there was that, you know, you're approaching a problem and you're quite familiar with the original problem you want to tackle. But it is the problems behind the problem that actually are the overwhelming challenges we face. You know, I mean, so some of the things we came across was that what's the current surveillance information that is available, i.e., you know, not the data, but, you know, what do people know about current disease trend? Because our original purpose was to do something about early detection. So that was the first challenge we faced. And I had before moving to the UK worked in local government area as a PhD coordinator. So I'm quite familiar with the challenges at that level in terms of those sort of things. The next challenge, of course, we then faced was, in order to do that, we wanted to get access to existing data. That is a problem again in terms of where is data, where is it stored, but also in terms of in what format, you know. So eventually we got this very archaic Excel files that were locked, that had all sorts of corruptions within it, you know. So that created its own problem. Then there is, of course, the perennial problems of data in developing countries in terms of data quality. So we ran into those challenges as well, in terms of the incomplete data, error in the data, what could we do about, and finally, again, there are issues around data validity. So is what they're reporting, what are those do those actually match the clinical cases? So those were sort of the initial challenges that were behind the problem that we were trying to solve. Further on, when we then sort of identified those and we're sort of thinking very innovatively, trying to overcome those, then you came across the issue of, well, okay, actually, if you solve this problem, because potentially early detection of outbreaks and clustering is something that, one could find a solution to relatively quickly, but then it is, how do you future-proof your tool? So when you future-proof your tool so that it's relevant in solving the challenges that are ahead, so it's not just about solving that immediate problem that you see. But when you remove that, is then thinking, okay, what other challenges will come across, and can this tool be useful to be applied in that? A big issue, as you guys will know, with doing kind of any form of work or intervention in the public health space is the sustainability. So even if you get someone to fund it the first year, or the first 2 years, or the first 3 years, how will this thing continue to sustain itself? And a big part of what we approached that was to make sure that the solution we built is sitting on an existing platform, sitting on an existing system. So we didn't reinvent the wheel. We didn't create parallel systems. We looked at existing systems, even though they're not perfect, but we felt that we could build on it. We could then augment it with additional tools in order to get to where we're going. And I think ultimately, when one is doing innovative work, it is important to be able to evaluate so that others who are others who do not have the bias, you're the one who is involved with that piece of work, they can look at the evaluation and they can critique it, they can give you feedback, and and if it survives that peer review, people accept it as a feasible solution. I think I'll just stop at that point.
Okay. So thank you so much, Femi. And I think if I just pull everything you guys have said, together, issues around designing with the user in mind, data quality, not reinventing the wheel, leveraging on resources that are already existing. Of course, how do you begin to design with the very real issues of antimicrobial resistance, just as Estelle, has explained. So I think at this point in time, let's just throw it open to the members of the team who will be shortlisted for the hackathon. Do you have questions about what any of the three speakers said, or specific questions about the hackathon coming? Then we can just take the next 10 minutes to talk about those, and then we can discuss. And I think there's Is anybody speaking?
What are you doing? No!
Oh, so much.
He's still out there. He's not
Sorry.
holding hands. Come on, Silver. I'm sorry I ever doubted you. Please.
Oh, jeez.
I didn't hear anything.
Somebody was watching Z-World or some telenovela or something.
Oh, really? Interesting. It's all part of technology. So, yeah. Okay, so Bayo Ishola 20 says none from this end.
Yeah, I think if you have a question, maybe text it and then we can unmute you so you talk. I think that's the way to do it.
To be honest, the questions don't have to be technical. Any questions at all that you have regarding the hackathon? You know, the organization, what are some expectations? You know, we're happy to answer those. Even if you don't have questions and you have, you know, contributions that you want to make, that's fine. You know, but based on what has been said so far and also the hackathon that we're planning. Falakemi, you have anything to say? Okay, I think Falakemi is mute. Okay.
No, can you hear me?
Yeah, we can hear you now. Yeah.
Okay. No, not exactly.
No, we can hear
I'm
you.
just happy. Okay, great, awesome.
Yeah.
I'm in my car, Lagos traffic.
We can all relate to that.
Who is going to do the solution for that?
I don't know.
Okay, so I mean, for like, I mean, what's your team building? What's the idea you're coming with?
Okay, we want to create an app that will help with early reporting, disease reporting and surveillance. We realize that most of the disease surveillance that's being done is not really is not involving the people in the field as much as it should. So I mean, we have phones for social media. I mean, we use our smartphones for social media. We use our smartphones for emails, and we could, also use our smartphones as for health workers specifically to report infectious diseases. Trying to create a platform where they can have direct access to maybe the DSNOs or the state epidemiologists via an app, and that will make disease reporting to be more effective. As even in this where I work sometimes, when I have notifiable diseases, I work in a teaching hospital, we're not able to report them as quickly as is necessary. There's still that long protocol, which sometimes can, waste valuable time. So if you have an app that can, make that faster and also give people an idea of the geographical locations of some of those infectious disease outbreaks, then it helps people also it helps health workers to also have a higher index of suspicion and notify the relevant authorities earlier and more effectively. So something, that's kind of the idea that we're working with. It also help with data. And then, for instance, if someone reports something in a particular location, it puts everyone else in that location, health workers on high alert, not the public, so there's no panic, but health workers can also be on high alert. They're looking out for, people, because sometimes people are not really expecting that particular problem, so they're not really looking out for it. But if there's somewhere where we can all communicate and just check, oh, someone just reported something here, we know that this area we should be more alert, basically. Something like that, Sha.
Okay, so Femi, do you have anything to say to that?
No, I think it's quite interesting, as I was talking about the cost behind the original solution one set out to have, and their outlook seems to align quite similarly to what we started out looking at, which was we wanted people to identify outbreaks quickly so that public health authorities can do something about it.
Yeah.
And so, part of the solutions, for example, that we developed was developing an app that sits on on tablets that are issued to healthcare workers, and for them to then push that information. But it also seems that actually what she's suggesting is something that actually a lot of people think is a very fantastic idea. So I commend you on that, which is, leveraging, the public's smartphones to actually also communicate effective disease information. So I think that certainly offers some very serious solutions out there.
Okay. Okay. Folakemi, thank you for sharing your ideas. But let me also throw it out. So because for this hackathon, there will be mentors, who will sit down and offer their, ideas and criticisms, of the ideas that you've come with. I hope your team is open to at least suggestions on how to make your ideas better. Yeah. Okay. And of course, this is also to every other person, because the whole idea is mentors. We have mentors from the health and the tech side, that will sit down with the different teams and, kind of play the devil's advocate, if you like. But ultimately, is to fine-tune your idea and make it much more viable at the end of, the 3-day hackathon.
I think I would like to also add that I think we're sort of moving away from such prescriptive solutions. You mentioned about being on the field, including the field agents as well, and getting that information from the field, because we're sort of trying to move more towards more embedded research techniques. So with something like this, where you're saying they'll report faster in terms of AMR. Obviously, the faster you report, hopefully that will be linked with some kind of platform that can also lead to faster diagnostics and etc. So more comprehensive treatment, which is where we're having the challenge here. With more, there's a lot more empirical treatment added to the problem. So if we're moving towards, getting the people, the end users, both in the health space or the public, some capacity, more embedded in that research process. I think that's where things are shifting towards, really.
So Estelle, if I heard you right, you're talking about, embedding whatever solution you're coming up with an existing platform.
No, it's embedded. Not that, definitely ideally, because with these things, if I'm speaking on AMR, particularly or infectious diseases, there's so many vertical programs happening on this with a lot of these diseases. So definitely the goal is to try and make them more integrated, and rather than having parallel programs. But I'm talking about embedded research in terms of the end users. So it's sort of like, instead of doing more prescriptive, which is what the old school consultants used to do, they come and give you a solution. Okay, this is how it's going to work. This is what you need to do. It's more around building with the end users in mind, but also building and sort of adapting with the people that are using the platform. So you embed the solution within the space of the people that would use it as well. So it's not so prescriptive. It's not just, have a solution, there you go. For example, you have, in my experience, I remember we had solutions where really great tech solutions were built for using in the clinical setting, but we found that ultimately, because they didn't carry along in my case, the pharmacist, and some of in bigger picture, we found that when we came to use it, we couldn't do a lot of the things that we wanted to do, or they were not legal for us to do it the way they built it. So instead of embedding your process within the people that are also the end users, basically. Yeah.
Okay, yeah, so and that's the same thing with what Ibeme said about designing with the users in mind. Because ultimately they're the ones that will use this product, and starting with them as the first, at the first instance, obviously provide value. Okay, so somebody.
I think someone, Van, wants to ask a question.
Okay.
Hi, everyone.
Hi.
Yeah, so sorry. I actually came late to the meeting. Lagos traffic issue thing. going to come along the line. Thank you. I basically want to share the thought of our project. I think the ideas raised so far has been so interesting. We're looking at solutions that, IT solutions of half website, but we're now taking a new dimension into the area of health. What we're trying to look at is we don't just want the health workers to be the one that are actually reporting these cases, or they're waiting for people to be the one to report the case directly. We see that there is a lot of gap between the general public who are having these challenges and the health workers sometimes. So what we're looking at is having a app that is intelligent enough that when people report any case, the app is able to decide on its own with some algorithm and intelligence what exactly is it close to in terms of available infectious diseases that have been uploaded on the app by the admin, so that they can now inform the public health workers. There will be a direct access to maybe state epidemic bodies, public health authorities, such that they can quickly move in and check if those kind of things are actually happening in that zone, and they can know with that area. So I think that will make it faster, and it's going to make it easy as long as it itself is the one triggering by the report it's getting from the general public. Everybody is involved in this now. It's like everything starts from you. So if you observe anything unusual and you put it up in the app is going to be intelligent enough to map it to some set of diseases and be able to inform the authority online real time for them to take an action on it. So that's just one part of the project we're working on. Okay. I just think I should share it.
Wow, excellent. Thank you so much for sharing that. Again, I go back to Femi. You're the infectious diseases epidemiologist there. What?
Yeah, no, I like I said, I think that's the future, honestly, because we're already doing it. I don't know, if any of you guys are familiar with syndromic surveillance. Syndromic surveillance is quite a big deal, and what they've tried to do with syndromic surveillance is to get around the sort of challenges that, sorry, I forgot your name the last week, all the challenges that you're trying to solve using your algorithm. But, obviously, if you have an app that is intelligent enough to do that, that's great. You may find challenges around standardization. So if you have an app that, based on the algorithm behind it, it picks one disease, somebody else may have written their program so that it picks a slightly different disease. But maybe the space to consider is syndromic surveillance, where individuals just report their symptoms. If they report their symptoms and pass that on to the central epidemiology unit in the state or the LGA, they can then look at all the data that is coming in the health facility, that is coming in from novel data sources like pharmacists and things like that, and they can begin to build a picture of what it is likely to be. Because I think, for example, if you just look at, for example, malaria in children under 5 can present with fast breathing, and somebody can, so an app can easily classify that as pneumonia, but it's because it's in an under 5, so it could be malaria. But if the information they upload just says, oh, maybe this is the person's age, fast breathing, temperature, and just outline the symptoms, then you can use that for syndromic surveillance, and the public health authorities can leverage that. It certainly was one of the things that we were hoping we could do, but then we found that the system that we're building it on was reporting diagnosis, not the symptoms, and so we backed away from using syndromic surveillance for our own solutions. But I think you're definitely on the right track. Your eyes are firmly fixed on the future, because I know CDC in America is exploring those sort of solutions in terms of bioterrorism, so that people can report when if somebody is becoming well, you can push that information on the app, and if they are declaring in a particular area, then they can identify that maybe there has been a deliberate release of a bioterrorism agent.
Okay. Excellent. So again, I think what this also shows is that once the hacking process begins on Friday, there's going to be a lot of back and forth between the mentors and the different teams. But ultimately is to really support the team to, at the end of it, have a workable solution that they can demonstrate to judges before the end of the hackathon, because subsequently, there's an incubation program that the top 3 teams will participate in, and also a virtual accelerator program that is offered by TechRank that they participate in. So, so I don't know, Ibeme, do you have anything to say? Maybe you chip in, Estelle can chip in. But before you come in, just one more thing. Just add this. I also hope that the team members are also thinking about how to use social media for the different so that they're thinking of. And a statistic that comes to mind is that 24 million Nigerians log into Facebook monthly. And 12 million Nigerians log in daily, and those 12 million log using their smartphones. Yeah, so we see an opportunity there, because we try to contextualize that Facebook population to say, if Nigerians in Facebook if they constituted a state in Nigeria, they will be the largest state in the country, larger than Lagos, with specific locations. We know how to reach them, we know what their interests are. So we think that, as we go forward, even for the team members, so thinking about your solutions even before you come to Abuja. Think about it. How can we explore benefits that social media, provides? Because it's what the Facebook statistics tell us is that people carry Facebook with them wherever it is that they go to. I've seen studies that maybe close to about 75% of people, once they wake up, the first website that they visit is Facebook on their phone. So an opportunity is there. Let's just think about it. So if you can chip in, Estelle, you chip in, then Ugonna can just round up for us so that we can.
Okay, yeah, no, I absolutely agree, Franny, that social media is really key. And some people on Facebook all the time. I personally, my poison is Twitter. I'm always on Twitter. But social media is quite powerful. And I know I've built solutions around social media. Recently I published something on breast cancer and using free basics and SMS reminders for self-breast examination. And it's remarkable how far and how deep solutions can go, leveraging on Facebook in particular. So I definitely echo that. And also, I guess, to harp again on the idea of sustainability, I think it's particularly key, because it can be quite hard when you're looking at infectious disease. It can be quite hard to know where to go for sustainability. So I think thinking hard about how the solutions will be sustainable will be something we'll have to do a lot even before the day, and have a lot of discussions around it. So my own take home really for today is sustainability. Try and make solutions that are sustainable. Otherwise, we'll be back here again in another 2 years' time trying to hack the same things all over again, which is not ideal.
Okay, thank you very much. Estelle.
I think this I'm really excited to see what solutions people come up with. I think I'm just really excited. I want to see hopefully there'll be things that are really simple to use, because sometimes we overcomplicate these things and then you're trying to build something and it's so complicated, but ultimately then doesn't get used. So it's not, so I'm looking for solutions that are user-friendly, and I'm really excited to see what people come up with. Thank you.
Excellent. Okay, we're gonna just wrap up so that people can proceed to the businesses. And those in Lagos traffic can go home.
Hi, everyone. First of all, I'd like to thank everyone for being here. We're really grateful that you guys can just chip in a few minutes after a long day of work and join us. So I'll start by saying one of the things that we've really thought about with organizing and designing this hackathon was context. Context, 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 context. We thought about how to build it by incorporating health personnel entities, hosting little meetups, and now this webinar, all to strengthen context, because the health sector in Nigeria is far behind when you think about technology. So as far as the only way that we can actually bridge the gap with what's happening in the world and in Africa and Nigeria is to use technology. But still on that, we need to understand the context, what's happening here. We don't have constant light. We don't have good roads. There's so many things that can hinder using technology to provide solutions. So I just like kind of like a brief advice to everyone who's going to be participating very strongly about context while doing this. I'd like to thank Dr. Femi, Estelle Mbadiwe, Ikeme Nito, and my boss, Dr. Ifeanyi Osofo, for putting all of this together. The hackathon will start on Friday morning. I'd like for everyone to prompt and come where big ideas are in your heart. Let's see where we can take all of this to. So thanks again, everyone. Really lovely to see you guys here. Can't wait to meet all of you in person and just stay human.
Good. And Ugonna now sounds like a politician, but that's fine.
I'm campaigning 2019 is not fun. I'm doing what I have to do.
I mean, okay. Just a little bit of asking Ugonna. I don't know if you can just put this back for the benefit of the team members, our plans for supporting them with accommodation, as well as, just the general outlay of what will happen on Friday.
Okay, so I've been in contact with a lot of you about your plans when you're here, your accommodation plans. We do have accommodation for everyone who's coming out of town who will be needing accommodation here. I wouldn't where exactly be staying. Most of you will be staying within the hackathon grounds, which is very grateful to Ventures Park for providing us with some accommodation there. There's also going to be some of you living outside because the quarters they have not enough to fit everyone. So also be sharing with you the contacts of people there so that when you're arriving, you know who to call and where to. So for the hackathon, a lot of you who applied using F6S or who applied on Twitter or through our website would have gone through what the prizes would be. There's going to be prizes. And there's going to be, for me, what's really, really exciting, the incubator hub that we've kind of put together using our partners. So Digital Health Nigeria, Tech Ranch, Pandemic Tech, and Ventures Platform have all come together to sort of create a bespoke program for the winners. It's going to be really a really dream program, but we hope that you're going to enjoy it. So the program at Tech Ranch is actually an award. It's an entrepreneurship program around tech startups. If you could just Google Tech Ranch and see what they usually offer, you'll understand how impactful this will be to the winning teams. So we just really want you guys to come like full of excitement. Just try to enjoy this next few days. Understanding that people will be like the panelists, the judges, the mentors. Most of the mentors, they come packed with experience and they can help you moving on from the hackathon. I'll tell you I'll do you one solid and tell you that the actual concept of this particular hackathon started with people who are trying to find in Nigeria the people who have the talent to do these things. So it goes beyond the prizes. It goes beyond, it's basically almost like a scouting session. People who are passionate about working in infectious disease space. So I really want everyone to come with their best and give it their best shot. on the day. So
Okay.
we only,
Okay.
yeah.
Thank you so much, Ugonna. And I mean, please, let's also try and enjoy ourselves. Let's network, get to meet friends, because I mean, we really don't know where this will take us.
Yeah.
So once again, thank you, Femi. Thank you, Estelle, Ibeme, Folakemi, and all. I can see Olucha, Pastor Lee,
Lillian,
Bayo. Please, thank you so much for making our time to be part of this hackathon. We're very grateful for your time.
Thank you, guys.
Thank you. Thank you. Bye.
Thanks a lot, guys, for organizing this. So very well.
Yeah. Thank you for organizing it. Yeah. Have a good night, everyone.
Sorry for the break in transmission.
Thank you. Good night, everyone.
Bye.
Bye.
Oh, who's that?
I'm saying thank you for the webinar. Thank you guys for having us.
Thank you so much, sir.